Dr. Nadir, you are muted.
Okay, Assalamu alaikum.
Assalamu alaikum, everyone. Thank you, Dr. Hajer, and your team in advance. Here's the agenda items, and when you are ready, Dr. Hajer, please go ahead.
Okay. Assalamu alaikum, everyone. I hope you are doing well. Today, the GRAE team presentation. The agenda for today is hypertension will be presented by Dr. Shiraz Eid, and how to write a perspective essay by Dr. Eiman Ahmed, and lastly, logistic regression in Google Sheet presented by me, Dr. Hajer Ali. So let us start by hypertension in elderly by Dr. Shiraz. Let me share the screen.
السلام عليكم ورحمة الله. I'm Dr. Shiraz, حسب رسول الطاهر عيد, consultant of Obsangina and assistant professor in International University of Africa, جامعة أفريقيا العالمية في السودان. I will present today hypertension. Next. The objective of the lecture today about how to diagnose hypertension and treatment of the hypertension in elderly patient, and also when we start antihypertensive drug and when we recommend the lifestyle modification, and how to choose a specific class of antihypertensive, and also the principle of the therapy. Topic covered today is epidemiology and clinical evaluation, treatment, including lifestyle modification and follow-up visit, and also the special consideration of hypertensive emergency, urgency, and long-term setting and follow-up. For the epidemiology, the blood pressure, we say hypertension when we have high blood pressure or blood pressure above the average or normal, which is above 120/80. And we found that blood pressure is increasing with age, especially the systolic blood pressure and pulse pressure. In American aged more than 65 years, the prevalence of the hypertension is 50 to 70%, and it is most among the Black and in the women more than the men. Elderly patients, as I said before, they more prone to have isolated systolic hypertension, and more than 65% age more than 60, and more than 90% of populations they have in elderly patients, they found to have isolated systolic hypertension in age of more than 70. The isolated systolic hypertension, it is associated with increasing risk, two-third-fold increasing risk of the stroke, myocardial infarction, cardiovascular mortality, and coronary artery disease, atrial fibrillation, chronic kidney disease, and retinal disease. The classification of the blood pressure, according to American College of Cardiology, categorized into normal blood pressure when we found the systolic is less than 120 and the diastolic is less than 80, and pre-hypertension when we found the systolic is less than 140 and the diastolic is less than 90, while the hypertension is stage 1 and stage 2. Stage 1 if the systolic blood pressure is less than 160 and the diastolic is less than 100, while stage 2 if we found the systolic is more than 160 and the diastolic is more than 100. In physiological change with the age, as we said, there is high risk for elderly patient to have isolated systolic hypertension, and as general, they prone more to have hypertension because of increasing arterial stiffness, decrease in baroreflex sensitivity, and increase in sympathetic activation and vasoconstriction. And also, there is alteration in the renal function and neurohumoral system that is involved in the sodium balance. The etiology of the hypertension, we have two types of hypertension, either it is primary hypertension or secondary hypertension. The primary, or we called it essential hypertension, it is in 90 to 95% due to genetic cause or environmental cause, and most common associated with a strong family history, while the secondary hypertension, there is underlying cause, can be endocrine, like Cushing, thyroid, parathyroid disease, or renal disease, coarctation of the aorta, or obstructive sleep apnea, and also drugs. Next. How we can diagnose hypertension? If we have a high reading of the blood pressure in 3 different visits, we can diagnose it, or consider ambulatory blood pressure monitoring for the patient with extreme blood pressure variability or possible white coat hypertension. Also, we should determine when we measure systolic blood pressure to make a palpation to avoid scaltatory gap. Next. In 2017, American College of Cardiology considered 130/80 millimeter mercury as a hypertension, while European Society guideline maintain reading 140/90 to be considered as hypertension. For clinical evaluation, we need first, if we found any high blood pressure in the patient, to exclude the secondary cause of the hypertension, and also to identify if there is any end-organ damage or any organ is affected, and determine if the patient he have cardiovascular risk factor, if he have any other comorbidity like renal disease, as I said, or diabetes or anything, and inquire about the lifestyle of the patient, if he is a smoker, and about the dietary intake of the sodium and fat, alcohol intake, physical activity, all this should be taken in the history. Benefit of the treatment is reduced overall mortality of cardiovascular disease and cardiovascular event and heart failure and stroke. The treatment, it has effect more in the men and the patient older more than 70 years and the patient with the greater pulse pressure. And also the benefit of the treatment to maximize the quality of the life and to prevent hypotension. In the target, when we give antihypertensive treatment for the patient, we have a target to reach it. We focus on systolic blood pressure and the pulse pressure. In general, the target for systolic blood pressure to be less than 140 or between 135 to 140 millimeter mercury, and diastolic blood pressure less than 90. And in type 2 diabetes, the target to reach systolic blood pressure less than 130 millimeter mercury. If systolic blood pressure is very high, we have a target for intermediate target to be the systolic blood pressure less than 160 millimeter mercury, because maybe later initial goal in the absence of the target organ damage. For lifestyle modification, we start for 6 months to make a lifestyle modification for 6 months for non-diabetic patient with stage 1 hypertension, and adjacent to drug therapy for all hypertensive agent. For lifestyle modification, can be reduction of the weight, exercise, cessation of the smoking, cessation or decrease of alcohol intake, decrease sodium, saturated fat, cholesterol, and maintain adequate intake of the calcium, magnesium, and potassium. After we have the modification of lifestyle for 6 months and follow the blood pressure, we can, if there is still no control, we can add antihypertensive drug. We start with the diuretic. Start with low dose side diuretic. If the blood pressure is more than 20 millimeter mercury above the target, we can add to the diuretic angiotensin converting enzyme inhibitor and initiate the therapy at the half the usual dose and then increase the dose slowly. Also, we should avoid excessive decrease in the diastolic blood pressure less than 70 and don't use aggressive therapy if because there is a risk of adverse effect like portal hypotension which cannot be avoided, and avoid central acting agent especially in elderly patient because also there is a risk of the portal hypotension. And at the same time, we have antihypertensive drug, continue the non-pharmacological therapy or the modification of the lifestyle. The first line, we start with diuretic, and it is preferable as initial therapy because it is safe and the dosing can be once daily, low cost, and there is a significant benefit in the reducing the mortality in stroke and coronary event. It is better than the other agent in reducing the systolic blood pressure, and we should also put in our mind to add potassium replacement therapy to prevent the arrhythmia and minimize the glucose intolerance. The action of thiazide diuretic, it is acted by inhibit of reabsorption of the sodium and chloride from distal convoluted tubule, and that results into decrease of the venous return and decrease of the blood pressure, and also decrease the risk of stroke and cardiovascular mortality. The second angiotensin converting enzyme inhibitor, it is acted by block the conversion of angiotensin 1 to angiotensin 2. And as we know, the angiotensin 2 is a major vasoconstrictor. That means we make vasodilatation, resulting to decrease of the venous return and also decrease of blood pressure and mortality from myocardial infarction. ACE inhibitor can be used as initial monotherapy for simple hypertension in elder patients, especially the men. And generally, it is well tolerated except of the side effect like the cough. And there is no adverse central nervous system effect or metabolic effect. It is well suited also for the patient with diabetes because it can protect from the diabetic nephropathy and those with left ventricular systolic dysfunction. Side effect of ACE inhibitor, dry cough, hypotension, and hyperkalemia. For angiotensin receptor blocker, third line, it is acted by block angiotensin 2 receptor, lead to vasodilatory effect and decrease the venous return, decrease aldosterone, and decrease the blood pressure. It is not well studied in elder hypertensive patient, not appropriate initial monotherapy, and option for the patient with diabetes, heart failure, chronic kidney disease, especially those unable to tolerate ACE inhibitor. Calcium channel blocker. For calcium channel blocker, it is reduce the peripheral vascular resistance and no adverse central nervous system or metabolic effect, and can be first line treatment in elder patient if the diuretic is contraindicated or if they have angina or heart problem. An option also it is option for the second line therapy generally with thiazide diuretic. Side effect of calcium channel blocker, vasodilatory effect, can cause ankle edema, headache, and portal hypotension. For beta blocker, it is not recommended to give beta blocker at the first line monotherapy, especially in elderly patient. It is less effective than the diuretic in reducing the blood pressure. It is more protective from the myocardial infarction, but also we should consider that it is associated with persistent depressive mood, which is rising problem in elderly patients. For the alpha blocker, there is a high risk for postural hypotension when use alpha blocker in elderly patient, and most commonly used for the urinary symptoms that is related to benign prostatic hyperplasia. One of the alpha blocker, it is monoxidil and hydralazine. We found that it is cause fluid retention and reflex tachycardia, while the central acting agent alpha blocker like clonidine can cause sedation and bradycardia, rebound hypertension if stopped abruptly. When use the alpha blocker as monotherapy, it is associated also with high rate of cardiovascular event. For follow-up visit, when the patient came in follow-up, we need to assess how extent the patient is adherent to the therapy, and to monitor if he have any adverse effect from antihypertensive drug like the postural hypotension. And also we need to measure the blood pressure in standing position and on supine position, and to encourage the patient for self-monitoring of the blood pressure. And also we need to adjust the dose cautiously. For frequency of the follow-up, also we should reflect the degree of the blood pressure elevation at the presentation. In general, allow 1 to 2 months between the visit, except if the patient he have hypertensive emergency. The rapid reduction of the blood pressure is unnecessary, unlikely to be deleterious. Months of the therapy may be required to reach the blood pressure target. Refractory hypertension. What is a refractory hypertension? It is the uncontrolled blood pressure despite use of 3 antihypertensive agents of different classes in maximum dose. And the factor contribute to the refractory hypertension can be incorrect technique of the measurement of the blood pressure, or poor compliance or adherence of the patient to the treatment, inadequate dose, inappropriate combination of the therapy, or sleep apnea. For adjusting therapy, we need to assess the adherence to the therapy and review the other medication, and cautiously increasing the dose. And if we need to add another dose or another antihypertensive agent, especially when we use the diuretic, we can add ACE inhibitor or angiotensin receptor blocker, or switch to the another drug classes. If the patient target is not attained on the 3 drug regimen, that is mean the patient have refractory hypertension. Consider the step-down treatment once the patient maintain target blood pressure for more than 1 year. For hypertensive emergency, the definition of hypertensive emergency is a vascular compromise of vital organ due to extreme blood pressure. That means we have high blood pressure to make vascular compromise or end organ damage. Like the patient is high blood pressure and have hypertensive encephalopathy, pulmonary edema, aortic dissection, and unstable injury. Management of hypertensive emergency, we need to admit the patient to the hospital and continuous monitoring of the blood pressure, and parenteral administration of antihypertensive agent. We don't initially target to normalize the blood pressure, and try to achieve 160/100 blood pressure gradually over 6 hours. For hypertensive urgency, it is defined as cases in which the blood pressure should be lowered within 24 hours to prevent target organ damage, and most can be managed with oral antihypertensive medication. For summary, as generally, the treatment of hypertension, it is reducing the risk of cardiovascular disease event and mortality in elder patients. Trial of lifestyle modification is recommended for non-diabetic patients with stage 1 hypertension, and low-dose Eid diuretic is preferable first-line treatment, and start with low dose and go slowly and monitor for the portal hypertension, and also if there is any other adverse event. Thank you so much, and if there is any question, I'm ready.
Thank you, Dr. Shiraz, for this well-presented important topic. If there is any question, you can go ahead. Okay, if no questions, we can go for the next agenda. How to write perspective essay by Dr. Eiman Ahmed. Dr. Eiman, if you are ready, go ahead.
Oh, yes, I'm ready. Assalamu alaikum. Hello.
Alaikum assalam wa rahmatullah.
Can you see my screen? Is it clear?
Yes.
Yeah.
Perfect.
Yes.
So today I'm going to be, first, my name is Eiman Ahmed, and I'm going to be presenting how to write perspective essays. So first, we need to know what is a perspective essay. So it's a type of writing where the author shares their personal viewpoint or interpretation on a particular topic, drawing heavily on their own experience and insights to present a unique perspective on the subject matter, often used in first-person narration to convey their individual understanding. So I'm going to be talking about some bullet points on how to write a perspective essay, so we can just have an understanding of what we're talking about. So first, you need to choose a relevant topic, meaning you need to select a subject that allows you to share a meaningful and personal perspective. Second, you need to, of course, analyze the prompt, meaning carefully read the essay question to identify the specific topic and the angle you need to take from your perspective. Then you're going to consider your audience. You need to think about who's going to be reading your essay. And with that, you're going to be able to tailor your language and explanation. Then you need to develop a strong thesis statement, meaning you're going to craft a clear and concise sentence that states your main perspective on the topic, acting as a central argument of your essay. To support this, you need to do some research and you have to have some evidence. So find relevant information to support your perspective, including facts, examples, expert opinions, and personal anecdotes. Then you need to create an outline, meaning you need to organize your argument into a logical structure with an introduction, a body paragraph, and of course, at the end, you're going to have a conclusion. Talking about introduction, you need to hook the reader's attention with an engaging opening statement and introduce and introduce your thesis statement. And also, when developing a body paragraph, each paragraph should focus on a single key point supporting your thesis. And then you need to use a strong topic sentence to clearly state the main idea of each paragraph. And then you need to provide an evidence and examples to back up your claims. Addressing opposing viewpoint. This is something optional. If you want to do it, you can. If you think it's not necessarily, you're just going to skip that. But with that, you need to consider acknowledging alternative perspective and explaining why your viewpoint is more compelling. And at the end, of course, you need to write your conclusion, and that will be summarize your main point and restate your thesis, and then leave the reader with a final thought or call to action. Of course, you need to make sure that everything you write is very clear, coherence, there's no grammar errors, and ensure your perspective is consistently communicated throughout the essay. To conclude of what I just said, we have 10 steps that we need to take to write our essay. First, you said we need to grasp the essay prompt thoroughly. We need to gather relevant information and sources. Third, we need to organize our thought with clear structure. The fourth point, we need to craft a concise, compelling thesis statement. The fifth is to hook the reader and introduce your topic briefly. The sixth point is develop each point with evidence and analysis. 7, use the transition of a smooth flow between paragraphs. Also, you need to support arguments with credible sources or examples. And you need to summarize the main points and restate the thesis. And finally, you need to revise the clarity, coherence, and the grammar. So the key point to take here is, or the key point to remember when writing a perspective essay is, you need to use your personal voice. Use I statements to clearly express your own perspective. Also, you need to strong support details, meaning back up your opinions with coherent evidence and examples. And then you need to balance your argument, meaning even when advocating for a particular viewpoint, consider acknowledging opposing perspectives. And finally, you need to engage language or use engaging language. Use vivid language and descriptive detail to convey your perspective effectiveness. Finally, when one wants to keep in mind that all essays have a basic format, although content and style will influence the shape and the composition takes. The introduction, where you get the reader's attention and then present your thesis. The body of the composition, where you support the patterns indicated in your thesis statement. This is where you will want to expand your illustration and examples and facts. Finally, the conclusion, where you bring home to the reader the purpose of the composition and what that drove you to sit down and take the time to put this essay together in the first place. And that's it. Does anyone have any questions?
Thank you very much, Dr. Eiman.
Thank you, Dr. Hajer, for all the audience.
Presentation. Any questions? Okay, if no questions, let us go to the last topic, is about logistic regression and how to present it in Google Sheet. I will be the presenter. Let me share my screen. Okay. So at the end of this presentation, you should be able to know what is logistic regression, when to use logistic regression, and how to use it. What is a regression? Regression is analysis that predict how much one variable changes in relation to the another variable. A lot of people ask what is the difference between regression and correlation. Correlation only measures the strength and direction of a relationship between two variables. That means how much two variables are connected. But regression will predict how much one variable change in relation to another. That means it predicts causality between two variables. Logistic regression is a statistical analysis method to predict a binary outcome, means dichotomous, such as yes/no, based on prior observation of data set. So the outcome is either yes or no, there is disease, there is no disease, only dichotomous, yeah. There are three types of logistic regression: binary logistic regression, in which we have two dependent variables. The outcome are binary, like fail or pass, yes or no, high or low, as I said. Ordinary logistic regression, the outcome may be divided like in ordinal. Critical, like health condition, critical, stable, good. Multinomial logistic regression, like the outcome will be like the colors, red or blue or green. So to understand logistic regression, let us step back for linear regression. In linear regression, the dependent variable, which is the outcome, is numerical variable. Example, testing if the number of cigarette smoke affect the blood pressure. In logistic regression, the dependent variable is dichotomous variable. Example, whether the disease is present or not. This is the difference between the two. So yeah, and x-axis and y-axis presentation, the linear regression will be slope like this, while the logistic regression will be like sigmoid shape. There's some difference between the two types of regression. In linear regression, the variable type, the dependent variable should be continuous dependent variable. In logistic regression, categorical dependent variable. The line, as I said, is straight line in linear regression, while is curve or sigmoid shaped line in logistic. The output, the linear regression predicted integer value, while logistic regression binary value, 0 or 1. There is or there is not. Application, we use linear regression in business domain, forecasting, sales, regression problems, recommendation system. Less. Logistic regression, we use is classification problems, cybersecurity, image processing. So we more use logistic regression. Yeah, this is a equation for the first equation is for linear regression. Y equal b0 plus b1 multiplied by x, which y is the dependent variable and x is independent variable or risk factor. Y is the outcome. Then to apply for logistic regression, we have the sigmoid function. We take the equation for the linear regression and put it here in sigmoid function. So the last equation for for logistic regression will be this. And yeah, the shape, when we apply this equation like this, the shape for logistic regression will be like this in for this data distribution. As we see, the data could be either 0 or 1. So the presentation will be like this. Yeah. Yeah, this is equation. Like this, we build the model for logistic regression. So this line for logistic regression is the same as a slope or trend line for linear regression. So basically, this line is doing using the formula, and it is best fitting line that fit this data set. As we said, the data, the distribution of data here and here. This is the best line fitting the distribution of this data. Yeah, I can't draw many lines, but one of them will be the best fitting. That is a sigmoid shape, this one. Okay. How can I use this model, the sigmoid shape? I can use it to predict the probability instead of having only 1 or 0. Here, 1 or 0, I can predict the probability. Depending on the probability, example, 30%, 7%, 23%. Like if I have the independent variable here, for example, here is 20 years old, 30 years old, 40, and here the disease present or not. You can predict like 20 years, he will have 77% chance to have the disease. 40 years old, he can have 85% chance. So here prediction of probability can be obtained from this graph. Other things that we can obtain is prediction of Y value. Yeah, we cannot know the exact Y value because this is a sample. So the predicted dependent variable value, you can like put a probability like 50%, 70%. You have to use that according to your data and you know your problem. If you most cases we use 50%. So anything above this value will be yes. Anything below this value will be no. This is usually used in classification. Okay, so if a patient is 20 years or 40 years, it will be the same. Yes, the probability is that he will gonna have the disease, for example. Yes, let us see how to use logistic regression on Google Sheets. First, my example is I have the independent variables, the body weight, and the dependent variable, which is dichotomous, should be yes or no, or 1 or 0, sleep apnea, or no sleep apnea. So using the data, you can do the following: develop a model, estimate the probability and odds ratio of dependent variable of certain independent variable, discover the value that gives you 50% probability, which is odd of 1 to 1. Okay, let me share Google how to do. Google Sheet. Okay, are you able to see?
Yes.
Okay, for those who doesn't know how to go to the Google Sheet, you go here to your Google account. Yes, Sheets. Then wait. If you want to create a new one. Just hit here in the blank one. Then you have to enter your data here. I just prepare one. Yeah. So this is a Google Sheet. I enter my data. I want to study the effect of body weight. If the dependent variable is the body, independent variables are body weight, and the dependent variable is sleep apnea, which is the outcome. This is body weight, different body weight, and this is the outcome. As we said, it is either yes or no. We give them the value of 0 if there is sleep apnea. If no sleep apnea, no sleep apnea. If there is sleep apnea, give the value of 1. Then to calculate logistic regression in Google Sheet, the odd ratio, the probability, we go to the extension, adds on, then get add on, then search up. We will search for XL minor, which is yeah, this one is a tool, a free tool that you can find logistic regression on it. I already have it installed here, so yeah. After you do that, you will come here in extension and you will find it here. Click start. Okay. Yeah, here we have different statistical analysis method. Here is linear regression, here logistic regression. So we have to fill this out to get the results. Input Y range, which is in, I'm sorry, it's dependent variable will be, dependent variable will be sleep apnea. So it will be B from, it's in the cell B2. B2 to B71, because I have 70 data set. Then the inbox X range, it's the X-axis, have the independent variables, which are the risk factors. So it will be A2 to A71. Then the confidence interval is set as 95%. Output range, where I like the data, the output to be. Let us choose E. Then hit OK. It's wrong. Yeah. Yeah. Then I gave the Google Sheet the data set, and by clicking here, by filling this one, it gives me all the outcome of the equation. It includes coefficient, standard error, p-value, odd ratio. Yeah, the most important, as you see, the p-value is significant, less than 0.05, and the odd ratio is 1.3. And this is a coefficient. If I did the equation manually, it will give me the same results. Okay, is that clear? It's very simple. So let's go back to the equation to see what does probability or odd ratio means in Google in logistic regression. Yeah, to understand the logistic regression application, we have to know, I know most of you or all of you know the probability. Towards the probability, let us make a quick review, is the outcome of interest divided by all possibilities of outcome. For example, if I have fair coin flip, I have the probability to get the head is 1 divided by 2. 1 is the outcome of interest, it's the head, and all possibilities are 2. So the probability will be 50%. Another example is fair die roll. The probability of having 1 or 2 is 2 divided by 6, because I need 2 probabilities, and the all options or all I can get is 6 options. So it will be 2 divided by 6, it will be 30%. This is the probability. What are the odds? The odds equal the probability of something occurring divided by the probability of something not occurring. So it's equal to probability divided by 1 minus probability. Yeah. So for the same example, previous example, the odds or getting the head is equal 0.5 divided by 1 minus 0.5, which is 0.5. So it is 1 to 50%, 1 to 1. Okay, the probability here is 1. For fair die roll, odds of getting 1 or 2 is the probability I get, which is 30% divided by the 1 minus 30%, which is 60 or 70%. Okay, so it will be 1/2, which is 0.5, or 1 to 2. This is the odd. This is the difference between probability and the odd. The odd ratio is equal to the first odd, or odd for the first equation divided by the odd for the second one. So it will be equal to the first probability, yeah, the odd, which is probability divided by 1 minus probability, and the same. So let us see odd ratio in logistic regression, how to interpret odd ratio based on output from computer calculator. The odd ratio for variable in logistic regression represent how odd change in 1 unit increase in that variable, holding all the other variable constant. Okay. So in my study of body weight and sleep apnea, if the weight variable had an odd ratio of 1.03, as we see in the results, what that means? That means 1 pound increase in weight increase the odds of having sleep apnea by 1.03, which is not very high, because we are looking for a 1 pound increment. Okay, only 1 pound increase. This number is not very high. So if the patient increase from, if increase from 120 to 121, the odd ratio will increase by 3%, 30%. 3%, yeah. Okay, 10 pound increase in body weight, increase the odd ratio, the odds to 1.98, which is almost double the person odd of having sleep apnea. 20 pounds increase the odd 4 times. Okay, so 1 pound increase only 3%. 10 pound increase like by 2. and 20 by 4 times. This holds true in any weight spectrum. What does that mean? Let me show you. If the person is 200 pound and he become 201, then the odd ratio will be 1.3. If another person in the data have 150 and he become 151, again, the odd ratio will be 1.03, okay? And if from increase by 10, the odd ratio will increase by 2, increase by 20, the odd ratio increase 4 times. That means it is very important to separate probability and odd ratio, okay? Because 20 pound increase their odd of sleep apnea by 4 times, regardless of their starting point. However, the probability of having apnea is lower in people with lower body weight to begin with. So while the odds are 4 times greater, the probability may still be low. Okay, the probability is low, but the odd ratio is high. This means that the odd can have a large magnitude even if the underlying probability is low. Okay, I hope you got this point. Yeah, okay. So this is how to do logistic regression in Google Sheet. I try to do it as simple as possible. I know this is a challenging topic. I hope you get it. Anyone have any question? Thank you for paying attention, and yes, okay, by this one, we complete our agenda for today. And if anyone have any update or any questions regarding the whole presentation or any comment, you are welcome.
I would like to give an update in regards to the papers that we are working on right now, or the research that we're working on right now. As a great team, we do have 2 topics that we're working on. The first is vitamin D in preventing and treatment of TB in children and adults. Both of them are systematic reviews. And the second is neurological and cognitive changes in adult post-COVID. As I mentioned, both are systematic reviews. So in the vitamin D prevention and treatment of TB, we are on the data extraction right now. So far we're so good on that. But in the neurological and cognitive changes, we did reach out to Prospero so they could give us the green light so we can go ahead with that. But we're still waiting on that answer. I do believe we sent it to a different email, so we had to redo that again, and we're still waiting to see if we can proceed with that. And that's about it. Thank you.
Okay, thank you, Dr. Eiman. I hope Dr. Nader is here, so he can comment.
Yes, I'm sorry, I'm driving.
Okay.
Did you have a question for me? Sorry.
No, it's just the update. Dr. Iman said what they have done so far for their project.
Excellent, excellent. So I'd like just to thank you all for great presentations, and thank you, Dr. Iman, for the update. And I think we have few new fellows. If any one of the new fellows has questions, please go ahead.
Okay, welcome to all the new fellows. If you have question, you can go ahead.
Hello, my name is Eiman Ahmed. This is the first time for me to attend the session. I want to know something about the programs and what can I do.
Welcome, Aribir. Yeah, you are new, and we have the application for telegeriatric. You can download this application at the mobile or in your desktop. Let me show you how to do it. And we have WhatsApp group also. We are divided into teams. Do you have team yet or not?
No, I want to join this WhatsApp group.
Yeah. So we are working, we have a weekly meeting. And the weekly meeting have presentation regarding geriatric topics like hypertension, cardiovascular disease, or hematology or anything. And then there is a topic about concerning research, how to do systematic review, how, different topic, and also the technology, like how to use AI in different things. Yeah, this is a weekly meeting, and then we have projects. You can, there is some suggestion in the application. You can choose from there, or you can bring your own topic and contact Dr. Nadir by email to see for example, the topic, if how you can conduct it, what to do. And after that, you can form a team and start doing like research or, yeah.
Okay, thank you. Actually, I joined the group maybe 4 months ago, but I'm not attended because at that time I'm busy for the exam. I think I sent to Dr. Nadir, and I started on my profile, but not done yet. When can I find the WhatsApp joining link?
Okay, I will try to send it to you.
Okay, thank you.
Okay. Yes, and it's okay to be busy or something. You can go, all the lectures are recorded. You can go back and see whatever you want.
Thank you.
You're welcome.
Welcome, Dr. Abir, and thank you for the question. So in the app itself, if you go to the app, as Dr. Hajer mentioned, I'm going to share with you the app here. So when you go in first time, you'll go to the first section here, and then below that there are a couple of links, and here's the Zoom meeting. So this is the the future meetings. You can look at the agenda for what's going to happen next week and the week after. But for you, you can go over the previous Zoom meetings. And as Dr. Hajer mentioned, it's recorded. So last week we have different items we talked about here in the agenda. And there are some links to the resources, but at the bottom you will find the recorded session for that date for last week and the week before that and so on. So if you have a specific topic you are interested in, you want to know more about it, if you click here, you go to the meetings, Zoom meetings, you can search for, let's say, kidney or heart failure, heart disease, or so anything about the heart. We have topics mentioned. So in a couple of years ago, in February, in July, or in January, we talked about some of the heart, and the year before as well. So you can look at specific topic if you are interested in using the Zoom meeting link. The other way to go around is to go to the videos. So we have a list of videos, some of them related to the Zoom meeting, some of them are just useful tips, and maybe, for example, here there are 6 free AI tools that one can use. So if you click on this, it will show you the video, the link, and some people might find that useful as well. So just browse the app and get yourself familiar with it. Thank you.
Thank you. Okay.
Any other questions or ideas from the new fellows? So we added for the seniors or the junior fellows, we added some new section here. If you go to the agenda here or the list, you go at the bottom almost, there's the leadership points where you can look at how we built the skill of leadership. So if you want to become a team leader, for example, what are the agenda items or the task, or how you deal with the team, how to build the team, and so on. So if you go there, it has like 10 sections or steps, and you can become a team leader. In the future, we want to divide the team into small groups or maybe subgroups. So each 5 or 6 fellows will work together on developing their own skills, like presentation skills, maybe interview skills, and so on. So you can also do that if you become a team leader. You can divide the team into small subgroups, and each subgroup can have their own subgroup leader, and then that leadership can rotate between the 5 or 6 fellows. So one can lead a subgroup for a month or so, the next one will do the same. So these are the possible things that you can do as a team leader. You can work on your project. If you don't have a project going on, you can join some of the projects that are people are working on. To get into that, you go also to the app at the bottom here. You will have projects, and then you can look at which project you are interested in. Some of them, they have some fellows who are still working on the project. Some are starting. For example, here, there are 2 fellows that are working on this topic. Here, another 2 fellows. So you can join, for example, here you can add yourself. And when you add yourself, you can ask, you will be asked what role you want to play in that. Just you want to be a member, are you interested in certain task? For example, you want to do writing draft or poster presentation if you have some skills with slide presentation or something, developing and designing. So after you add yourself, you will find the team members here. So the first one or second one, for example, this wants to be the leader, so you can contact them. If you go there, you will find their email contact. Then you just send them an email saying that I'm interested in joining the team. What task could I do? And then you can also work with the other fellows in the team. If you want to look at all your projects, it will be here. Your own list of projects will be listed here. So this is how you can get involved in a research project that's going on. Let's say you want to have a new project, so you can add a new project here. If you have an idea, you can give a title, then describe the project or the research idea. Hopefully it will be something new, or you can modify some of the projects listed there. If you have certain people in the fellowship that are interested, you can add their names or invite them. They can add themselves. You can add an image. You can describe the status if it's new project, the stage, and so on. So when you're done, just hit submit, and it will be listed here, so people can join your team and work with you. If you come up with a new idea, you can become the project team leader or the manager of that project. And when published, you may be the first author if you'd like, or anyone else can become the first author. At this time, authorship doesn't count much. Down the road, when you join residency, when you join the faculty, then it will have some weight or some importance to it. But at this time, we want you to get involved, publish your project, either in abstract or poster presentation, oral presentation, or maybe papers that you submit to journals. Some fellows in the past, they worked on mobile application development, and they published these. So these are also some new project ideas that you can develop or get involved. Some fellows work together to create webinars. So this is another way of getting involved. A different way is getting together. A few fellows can work on a seminar. Let's say some of you interested in SPSS. So some of you might know the basics of SPSS. So maybe we can develop a team so that they can present a seminar about using SPSS from A to Z, the basics. So we can set a date and then time, and then set who will present what part, similar to the meeting today. So one will start with introduction maybe, and then you will start how you download the app, the application in either Microsoft or Apple. And then how you start with the demo of the basic. It has different things. So you start with the basics, and then you start with some of the samples. They have some samples, and then you work on getting new data into the sample. After that, how you can develop the analysis, similar to what Hajer mentioned. There are different ways of presenting the data as the analysis in graphs. So you can develop your graph. You can start with simple bar shape or pie shape, and then do more sophisticated analysis. So this is how you can get involved into a webinar or a seminar, for example. This can be targeting international medical graduates, dental graduates, or even the public. We can educate the public about certain topic. For example, there is a need for smoking cessation session, for example, or the vaping. So how can we handle this? How can we educate parents who have their children, teenage, about preventing them from getting the habit or something like that? So we can develop a webinar addressing this issue or any other issue that you think is important for the public here in the US or maybe locally in your community somewhere. Let's say in Saudi Arabia, there is a topic that people are interested in. We can develop something, and any one of the fellows here can contribute and can present or be some of the host of the presenter in that webinar, if that makes sense. Any questions or any comments? Dr. Bahim, did you have any question or comment? You are asking about Team Green too? So if there is no more questions or any suggestion comments, I'd like to thank you so much, Dr. Hajer, and all the presenters from today. Great presentations. Thank you so much. And I'd like to thank all the attendees today's meeting, and then those who will come and look at the recording later on. Thank you so much in advance. Thank you. Have a wonderful day. If you have any questions or any comments, please reach me via email, or you can text or call me. I'll be happy to help as much as we can. Thank you, and have a wonderful day or have a wonderful night. Assalamu alaikum.
Thank you, Dr. Alaikum salam.
Alaikum salam. Thank you, Dr. Nadir, for continuous guidance and help and support.
Thank you again, Dr. Hajer.